Yeah, Beatrice, that was great, and I appreciated everything you had to say. So we're one of our challenges is that in writing a report that will actually get through review, is I think we do need to advance a narrative that actually does suggest what's possible. Um, we need to bring forward some big ideas. Costs too much money, takes too much time to simply lift up things that we already know. But they need to be actionable, if possible. And our sense is that we probably also need to point to some bright spots, some place or places where these things or parts of these things are happening, strong cases. So I was really interested in this notion of a hub collaborative and wondered if, lots of questions. Well, where does I think I know where the money comes from, but the broader question is, where should it come from over time? Whether or not this far along in what's a 10-year endeavor, you have any early insights as what likely to contribute to success or threats to success of which we should be aware. We have a subcommittee focused on trying to think about criteria, even for, where to look and how to choose, and wondering if either one of you might have advice for us about the criteria that we should apply in really looking for places where these kinds of things are happening. Last thing I'll say, this is an affliction I think is common both to the philanthropic community and the research community. We're driven to look for places where it might work anyway, where our criteria are neat and tidy, and we can easily, inadvertently design ourselves right out of the places where our ideas really need to take root. Very long question, I apologize for that, but I waited 10 minutes to ask it. Wonder if one or both of you could sort of comment on all of that.
Thank you, Mr. McGuire. Great questions there. So I'll try to address all of them. In terms of the Hub Collaborative, what we've learned over time is that we had, I didn't put it up there, but our 5 failures. I should have brought that in. I'm happy to share that as well. One of them is that we had this, if you can imagine, I'm not sure if you were a comics book fan, but if you think of the superheroes table where everybody comes together and we're like all ready to work, I think we had a pie in the sky dream that we would get the community organizer, we'd get the mom, we'd get the youth, we'd have law enforcement, we would have school administrators, public health officials, others coming to that table. And really quickly we learned that that's just not possible. And so taking the time around a collaborative and really shifting, for us at the endowment, shifting power from a foundation to community and say, okay, here are the ideas, here are the criteria, what we know from literature, this is what's really important in terms of having a thriving collaborative. How can we help support in helping you support, design, provide support? So each and every collaborative in these 14 communities is different. And it's different because they see it as lasting beyond our investment. So we have many sites, 5 sites in, that are saying, we want to change our name. Some of them are going after local, state, and federal dollars when it can come to very random things. So they're looking for ways to leverage this investment that we've made in them to see how they can sustain, because they've seen that as a collective and coming together, that they're beginning to shift power and to be recognized in community as an important community voice and vehicle to go to. So as opposed to in many communities where you go to that 1-2 nonprofit organization, maybe they're the loudest, maybe they're the best, and they're doing fantastic work, but they don't always represent all of community. And that's the challenge. And so what we've learned in terms of the early successes of the hub is there is seed money, there is technical assistance support that's needed, there is expert training, and many universities have this, and I know Nita Wallerstein presented earlier, some really good lessons on how to enter and how to check one's power in these conversations and to support. I say the biggest threat to the collaborative is one where structural inequities are not addressed and discussed at the beginning. I think at the California Endowment, what we learned is that if those are not discussed early on, they can hiccup and hold things back. And so if there's a key lesson, the key lesson is begin to talk about the structural inequities up front, up first. Really critical in terms of acknowledging the multiple traumas and bridge building among community members to begin to address the issues that maybe they haven't had the opportunity to discuss or share with others. In terms of criteria of where to start, we intentionally decided to go with rural, urban, and suburban communities, and also communities that had what we would consider sort of high capacity. So we had a high, medium, low selection that looked at, what were the existing collaborations that existed, how were systems leaders engaging community. So we looked at a bunch of qualitative factors as well, and we didn't want to just go with the ones that seemed like they would hum, but we felt that it was important to pick a mix. The mix is really important in terms of geography as well. A mix of geography so that when people to come together, the magical thing that happens with the learning community, and that's another learning, how to create intentful learning communities, not so much cooked up by a consultant or by a foundation, but really taking community's perspective from those collaboratives about what did they want to learn about. And what's interesting is what they learn about is absolutely critical for their survival and movement going forward. So creating those intentional spaces for learning together is incredibly important. The other part that I would say is you mentioned what's in the mix and what do you support? I mean, we studied a lot of what was happening in the promise zones, and I think there's a lot of promising practices within the promise zone, so I would encourage a lot of lessons learned around technical assistance support. Policy Link has been one of those organizations that's really been sort of culling together learnings. So I think there are learnings that you can take from Policy Link and the Promise Zone work. I think what particularly was great about Promise Zone is it really incentivized various departments in the federal government to work together and to work together in place. So when it came to housing, environmental justice, to education, to healthcare services, to mental health, it was a team and it worked in place. And I think that's where the Promise Zone work is most important. And I think that's where community also says, gosh, yesterday the person came by to talk to me about lead in the community because there's a battery plant 2 blocks away and they want to talk about remediation. And then you have the healthcare provider that's coming by to enroll them for health insurance or to connect them, but it's all fragmented. And so community is sort of dealing with all this fragmentation and are wondering, can systems come together and work? So I think Promise Zone work is one of those sort of nuggets that we're learning from and really encouraging our communities to learn from. So I think there are promising practices there. So I'll let Manal go.
I think we're starting to think a little bit in terms of systems of prevention and equity, and I think by definition that's complex, which means that the criteria that you select will inevitably be good but wrong. So it's kind of one of the criteria should allow for that, that, that there needs to be flexibility. And I think what we're seeing in terms of the notion of systems of prevention and equity or bright spots is there's probably a lot of places that have a lot of ingredients, but probably very few places that have all of the ingredients. And if there are places that have all of the ingredients, the questions of scale and replication immediately, will come up. And I think, so your question implied that the committee is already grappling with all of that, so I didn't say anything new. But some of the ingredients that we think are really important involve clarity of purpose and vision, and from our perspective, that purpose and vision must include a commitment to preventing illness and injury in the first place, and a commitment to equity. Another thing that we're really think is critical is this notion of multi-sector collaboration, fundamentally because the resources in one sector alone will not be enough, and all the sectors do need to come along on this for the fragmentation issues. The other issue is around a plan or a process for workforce and capacity building. And both the public health and community professionals and community need a new set of competencies than they have in the past to do this work, because we're redefining the scope of terms. And so that's really incredibly important, because even when we build all this capacity, if there's not a pipeline and jobs to sustain people, the work will fizzle. I think the other thing Bea talked about, which really struck me, is this inherent but good but challenging tension between government as the oppressive system and a useful role for government. And we all, any of us who have touched any public system, know lots of well-meaning, very good hearted people that went there to do the right things and are doing the right things, and somehow the structures, the funding, the infrastructure is not aligned to facilitate that kind of work. And any foundation, as big as it is only going to be, as Bea said, a drop in the bucket. So the question of how do we create sustainable funding mechanisms is an issue that I think we must grapple with. We're thinking about it in terms of this notion of closing the loop, and how do we capture savings and reinvest them in prevention upstream. And I think there's a number of mechanisms. And so a plan for that may exist either through ballot measures and so on. Inherently in a lot of this infrastructure work, we go from one ballot measure to the next, and that is its own problem. And so then I think you have a lead person from the Federal Reserve coming, so I'm going to stop talking about money. But that's, I think, an important piece. How do we get from foundation to sustainability of funding? The other piece Bea already spoke about, which I think in terms of criteria, is evidence or emerging evidence of youth and community leadership involvement. What I would just say in terms of our work thinking about systems of prevention and equity is to recognize that systems are built over time, and so we're kind of using the metaphor of a seed growing into a flower, into something, greater. And so I think part of the criteria has to be something like, along a set of metrics, what is this evidence of increased, moving from readiness to implementation to sort of full-fledged. And so I think that that's sort of got to be built into the vision for this. And of course, I think something that we didn't talk about much, I talked about comprehensive strategy, which leads to policy change, but one of the critical issues that we talk about is the importance of norms change. Norms change as almost more essential to sustainability than money. And so I think the notion of norms change is critical in these systems. I'm sure that the Endowment and Prevention Institute would certainly be happy to point to places that we think represent bright spots, but as I said, no one bright spot represents all of these kinds of ingredients, but I think some point the way to how important a combination of some of them can be synergistically together.
Thank both of you so very much, and I'm going to assume that my subcommittee appreciates the contribution that they just made, and especially the question that I asked to
Lee, go ahead.
I want to ask, you have some, thank you very much, Nick. You have some good indicators of progress from many of your sites. I'm wondering how long do you think it will be before you can get an effect that would be statewide? Are you aiming for that? Will the proof of your success be an impact beyond each of the sites? And are you going to be funding more sites in the hope of making an impact on the whole state? But where does your present work stand in relation to your vision of the future?
Fabulous question, Lee. Because our work really focuses on those drivers of change, those 5 drivers of change, it really has pushed us to think beyond sort of the off-the-shelf indicators because they weren't sensitive enough. So when we think about policy change and practice change, there are insufficient methodologies to capture that, other than saying, from a, sort of qualitative perspective, let's say Santa Ana Unified made the decision to, rather than spend $2 million on school police and school, which are called resource officers, and shift 90% of those dollars to restorative justice and school climate issues, that's a huge change. So how do you begin to then backtrack or look forward over time of how did that change happen? It wasn't just because the school board said one day, oh, we're going to change our funding priorities. It was because of the people power and the young people, and then them building support with other systems leaders and board members, school board members that thought that that was really important to do. And so how do you begin to track that, and then how do you look at it over time? There's quantitative indicators in terms of chronic absence, graduation rate, sort of standard data that can be used, and then you can look at it as school district, and that's where we see our work statewide having an impact. So the school to, what I call the school to prison pipeline, those particular policies and systems that might seem kind of obscure and unimportant, actually, when you identify several of them, which we've been learning in building healthy communities, it really creates a superhighway for young people of color in particular and low-income people on that school-to-prison pipeline, and it disproportionately impacts young boys. And so, again, no surprise that we have such an amazing incarceration rate compared to other developed countries in the world, right? So again, community having the wisdom, how do we keep our kids in school? And for a health foundation, we actually had to pause for a moment and say, geez, do we have expertise in this? How do we begin to support? But once we started supporting, it took on like wildfire. So one learning, just to build off what Manal was saying, is that learning practice, spread and scale will happen when you don't even expect it. We did not expect that bringing together young people from several different communities to talk about the school to prison pipeline would then lead to all 14 sites wanting to move in that direction. It just happened through conversation. And then they began to say, whoa, what can we do at the statewide level? So 2 bills were passed. And then it became more. And then local control funding formula, which is a shift in California around how schools are able to shift their dollars from a variety of programs to really focus on low-income communities, so more funding for schools and better local decision-making to place those dollars, support kids. So it had a ripple effect. So it is impacting, all school districts. Another impact was around healthcare, because we know with the Affordable Care Act, it left out undocumented. And in California, we have a large population of undocumented. So we funded and supported a campaign that's called Health for All that really looked at how do we begin to talk about a more inclusive society, and that because of your immigration status, that should not come in the way of you receiving access to healthcare services. And so that was another sort of campaign that sparked in mainly the Central Valley and some other communities that then took off, because then that advocacy had to happen at the, county and local level, which we know that hospitals and public systems, regardless of your ability to pay, regardless of your immigration status, need to see you. But they wanted to make it more intentful about how do you really prioritize and support children and adults that lack healthcare services. And as of this month, I can say that Senator Laura's bill on Health for All, which is launching today or tomorrow, I think, which will provide health care for all undocumented children under the age of 18 through Medicaid. So that is another sort of shift that came from community. In terms of other sites, I think where learning has happened is sometimes when we think about neighborhood, sometimes describing it really can kind of take away what that means. Because the communities that we're funding, I think the smallest one is about 100,000 people residing in that community, which is really, really large, right? But those systems that they're addressing are regional systems. So let's say it's a school district or, the city. So the changes and practice changes that they are making are actually impacting region. I would say where we've struggled is we probably don't have good indicators to, sort of show how scale up doesn't always mean that every community in California, but what does it mean about people in a geographic region that are benefiting from these policy and systems changes. In terms of where we're going, we're excited. We have 5 more years. We're learning a bunch. But we are already thinking about, lessons learned from government and from other foundations. What does it mean to, quote unquote, pull away from a 10-year investment? So we're very mindful. We've already started thinking about how do we consider a Building Healthy Communities 2.0? Is there something potentially around learning communities, folding in youth sites where the first sites that we're funding could then be mentor sites to help accelerate learning and connection between people to people? So we don't have an answer yet, but I can tell you we're now in the thick of really thinking early about those transitions.
Beatrice, just a quick question. I've noticed in the video that you showed, there's a focus on, when you compare Town A with City B, that it's not just about focusing on City B, it's about lifting both communities up. And I've noticed that in your descriptions, you talked about lifting everybody up. How do we make sure when we're lifting everybody up that we're not lifting disproportionately folks who are well-to-do and communities that are well-to-do, so we can actually worsen equity or lead to more disparities by lifting everybody up at the same time?
So I'll give you another way of thinking about it. One is that what we believe is that having a shared understanding and a shared responsibility is one that at this particular time, especially if we think about the narratives that are out there, they're really decisive, dismissive, really forcing some major changes in our society, how we think about, populations, whether immigrant, documented, undocumented, LGBTQ, refugees, religion, et cetera. The atmosphere, if you will, is very difficult. And so how do we begin to move the needle towards greater inclusivity? And how do we stretch that muscle to see that there's a shared benefit? Just to even get that on the radar screen doesn't necessarily mean that funding, let's say public dollar funding for schools, for highways, for transportation systems, that they then meander to communities that are middle or upper income. But it means that the upper income and those below it have a shared understanding of why it's important to support the Marias or the Karens or others that live in Beeville. It's that trying to get to changing that narrative of this shared buy-in, if you will, that all boats will rise. And you just can't deny the data. I mean, you saw where we fall in the United States and the growing inequities. I mean, there have been several reports that have come out that are just really clear about economic opportunity in the United States and how that gap is growing larger and larger. And so when it goes to the practicality, if you think about the operationalization of it, it's building the bandwidth in California to see that investing in healthcare services for undocumented kids is a benefit for everybody. Because if you have that child, either if you view it from, sort of hospitalization rates, or if you view it as children going to the same school, or playing soccer together on the weekend, or whatever, that there's an understanding that these kids are kids and that children matter and that we should support kids regardless. So it's that greater shared understanding that we're really trying to change that narrative. So I hope that addressed your question.
Last question, Robert.
This question is for Ms. Solis. You've mentioned several ways in which the endowment is engaged on legal matters. For example, the Affordable Care Act makes a huge difference, although it doesn't provide yet universal free medical care, and people of color and low-income people, including undocumented residents, are excluded disproportionately. You also mentioned Mr. Lara's bill to address the undocumented children, and that's wonderful. On the zero tolerance discipline policies in schools, my understanding is that there has been change there. And in part, I believe, it's because the United States Department of Education sent a letter to every school district, not just in California, but the nation, pointing out the disparities in Black and Latino students being suspended or expelled from school for the same claimed offenses that non-Hispanic white students were not disciplined for. So my question is, what is the endowment's practice regarding law enforcement? For example, the Department of Education relied on Title VI of the Civil Rights Act of 1964. So it's not enough, from my perspective as a civil rights and human rights lawyer, to have a law on the books. It needs to be enforced. But many foundations will not fund legal advocacy or litigation or, heaven forbid, anything to do with lawyers.
Excellent question. So I see that there are like two questions embedded in there. So one is about practice change. And I think Manal sort of also talked about practice change across systems. Absolutely important. With the school disciplinary work, we heard from principals, school districts, like, oh my gosh, how do we do this? How do we begin to integrate it in our professional development days that we have with our teachers? And how do we get a coordinator on campus that can help train teachers ongoingly, as well as help them understand data and provide that data support so that teachers are sort of addressing. So that really encouraged us to then help support and fund, sort of training and supports around restorative justice practices within schools. When it comes to law enforcement, the Advancement Project, now another project called Urban Peace, really looks at how do you help practice change within law enforcement. And it's not so much just the community policing approach, but there are other practices that are best practices that we're seeing across the country in terms of really addressing and including and thinking about prevention as opposed to suppression. So when you think about the tools of violence prevention strategy, it's along a continuum. But how do you, as a health foundation, we're interested in the upstream prevention. And so how do we help support and train, and there are groups across the country that do this sort of either disruptive training to really bring in formerly incarcerated individuals to work as interrupters when they see something occurring in their community. It's also law enforcement working with the data that they collect already in terms of looking at disproportionate impact in communities. In terms of the other question that you have, so that's what I would call sort of the practice change, constantly needed, really important to consider in place-based approach as well as statewide policy change, is around legal strategy. And what we've learned is that we've been supporting what we call medical legal partnerships. And this is where you have a lawyer that works on a multitude and range of issues that are connected with a clinic in a community. So as a patient is dealing with an issue of asthma, and the physician or the attending nurse or the nurse practitioner finds that there is a problem that this family is going to be displaced because of some issues with the landlord, or that they have a child that's involved with the justice system, or any other issue, that they're able to work with that legal person that's sort of embedded in the clinic to then help address those other things that impact health, as we talk about the social determinants of health. So a legal strategy in terms of thinking about it in a clinic. We also fund quite a bit when it comes in the schools work, because there's just a lot of lack of knowledge about how to address systems for young people to clean their records. In California, we have Proposition 47. So again, I would say that there's multiple strategies in terms of working with legal experts and attorneys.
Manuel, you wanted to add something?
Yeah, I just wanted to say that in all the work that we've done, and we've looked at major public health successes, whether that's tobacco prevention, lead prevention, or more smaller scale local ones, clearly the issue of legal strategy and carrots and sticks is important. And so I do think, kind of turning your question, Robert, into an area for the committee to develop recommendations on, it would be important, because I think that the important role of litigation or the threat of litigation is incredibly important in equity and civil rights, as you well know. And I think it's played and will continue to play an important role in advancing health equity struggles in several systems, either at the local and regional and so on level. So I do think that could be a very fruitful place for the committee to concentrate a section or some recommendations, both around the research and the funding and evidence of those, that as a key bright spot. We've just seen some great local examples in Los Angeles where that is really key when institutions don't move easily towards changing their practices to be more equitable. The threat or reality of, as you know, litigation can be very useful. So I think that skill set in community is clearly important. So I wanted to just appreciate you raising that, and even maybe the barriers to having that supported as part of a comprehensive strategy.
Thank you for the beautiful contributions. We appreciate it so much.
So we're going to take a very short break, 5 minutes, just, restroom, refill your coffee. There's coffee outside, like in that big hall area right out there. We're going to reconvene at 2:20.